So moving on here to Lingui Zhugan Tang. Just one herb different from Lingui Ganzhao Tang, right? Separating, s- taking out that da zhao and adding in bai zhu. So the line here for Lingui Zhugan Tang says, in cold damage after vomiting or purging, if there is counterflow fullness below the heart, chi rushing upwards to the chest, dizziness upon rising, and the pulse is deep and tight. If sweating is induced, it will disturb the channels, causing the body to tremble and shake. Use Fuling Guizhi Baitu Gan Cao Tang. Now notice also the Kangzhiben, which some people think is like an older version of the Shanghan Lun than the Song Dynasty version that's quoted above. It says, if the patient is purged after sweating and there is counterflow fullness below the heart, qi rushing upward to the chest, and dizziness upon rising, use Fuling Guizhi Baizhu Gan Cao Tang. Um, Now notice that the main difference here is that it takes out that second part. If sweating is induced, it will disturb the channels, causing the body to tremble and shake. So just remember that. Now, the dosage is, again, Fuling has the highest dose at 4, followed by Guizhi, then Gancao and Baizhu at 2. Gancao and Baizhu both at 2. So Huang Huang will do 12 to 30 grams of Fuling, 10 to 15 of Guizhi, 10 to 15 of Baizhu, and 3 to 6 of Gancao. Now, of course, in the Fengshui tradition, oftentimes they're going to be using Changzhu instead of Baizhu, and we'll get into that a little bit later. Now, there's another line from the Jingguo Yao Lue, which you can also keep in mind, which is for those with shortness of breath and slight rheum, treat by promoting diuresis with Lingui Zhugan Tang. So the mechanism, well, the first thing is we're just going to discuss briefly this um, part at the second half of this line here. If sweating is induced, it will disturb the channels causing the body. Because as we said, um, that line appears in the Song Dynasty version, but is missing in the Kangzhi version. And so many commentators believe that maybe that line should be under Zhengwu Tang, which already has this stuff about the body trembling and shaking. Now, there are others like Tang Zonghai and Lo Shaokun who say, it's possible for it to occur in both because there's a similar kind of mechanism at play, which is, of course, this body being depleted of fluid and yang qi. Um, with at the same time there being like some kind of exterior contraction. And so, like I say here, the when the patient is depleted of yang qi, that means water metabolism further diminishes, and so there can be a buildup of fluid in the extremities, um, but that fluid is not getting back into the circulation. Okay, it's just being pushed outwards due to there being exterior contraction. So that means that there's less fluid available from a physiological perspective. You'll see down here say there's a concomitant lack of physiological fluid. So if there's less fluid, less blood volume to carry nutrients to the muscles, then it can cause trembling and shaking. It can cause various spasms and things like that. So really, in Lingui Zhugan you're getting this breakdown of fluid metabolism. Um, Again, it's a little bit more pronounced than in Lingui Ganzhao Tang because in Lingui Ganzhao Tang you only have really Fuling, which is dealing with the room aspect. But in Lingui Zhugantang, you have Fuling plus Baizhu. So now you're using two of the strongest herbs in the Shanghan Lun to treat rheum. So you know that that's a big part of this, um, the mechanism here. And so let's go further into the mechanism. So as we know from before, from Huang Yanyu, we've talked about this a billion times. He says all cases of qi surging with palpitations arise from exuberant water, vacuous earth with constrained windward. So this person has that counterflow below the heart and qi rushing upward to the chest, which again is this kind of palpitations and qi surging situation. So in this patient, again, we're seeing the same thing. Due to there being this sweating or purging or whatever goes on, that at the on the one hand it's injuring yang qi, on the other hand it's just it's depleting fluid, and so as that yang qi is injured, then the transformation in the middle breaks down, the water collects. And so, as I say, the patient is in a chronic state of deficient water metabolism. Okay, so maybe this patient, like we say, most of these patients are getting either sweated or they're getting purged or something. So it's a bit about their own constitution and how they react to these things. So this person is going to be a person who is more susceptible to rheum disease. So when water collects in the abdomen due to that breakdown of water metabolism, um, that excess water alone can make the heartbeat felt more, which can cause palpitations. And it can also impinge on the chest cavity, which can irritate the heart, and it can constrain the movement of the lungs, which can cause that palpitations on the one hand or that shortness of breath. Now, the other aspect of this is that because we have this breakdown of fluid metabolism, we're getting a lower blood volume because water is just stagnating now and it's not going back into the circulation. And so that can lead to things like vertigo upon rising or POTS. Um, no, it can also lead to things like Meniere's. If you basically have any kind of breakdown of fluid metabolism, then of course that's going to affect the lymph system, which will then of course affect balance. Now, ultimately, I say the autonomic nervous system races to correct this imbalance. The imbalance being that there's just lower blood volume, um, which of course means that there's there's less oxygen potentially getting to all of the systems of the body. So the autonomic nervous system is going to try to correct that imbalance by initiating this strong and rapid heartbeat. And so that's part of why you get this chi rushing upward to the chest. Now, most of these herbs we've talked about before, so this should all be fairly easy to understand here. As we said before, Baiju, it's going to concentrate fluids in the body's center of transformation, the spleen and stomach. So, as we said, there's a breakdown of this fluid metabolism. And so we get more and more fluid just sitting and stagnant. And so Baiju is able to suck that fluid up and transport it back into the middle. Now, Fuling, we say, also works on that sort of stagnant fluid. And what it's able to do is once it absorbs that fluid, it also is responsible for sending it upwards. So Baiju is more diuretic and it more sends fluid downwards. Fuling is going to reabsorb and send it upwards. Gancao, we say, also helps in that in that moving fluid back into the blood, right? And so it it's also going to facilitate that process. Okay. Baiju, it's not really moving fluid into the blood. It's really we should think about it more of it moving fluid into the centers of transformation in the spleen, the stomach, in the small intestine. Because remember, also if you use too much baiju, especially raw baiju, um, it can actually overwhelm the spleen and stomach and cause diarrhea, right? So, whereas Gancao, it really is working to move fluid back into blood and retain it in the blood. So it's not being diuresed. And so, of course, that's going to recover some of that blood volume that's being lost. Now, guizhi, obviously, on the one hand, it resolves the exterior. So by resolving the exterior, it means that it calms some of that pushing out impulse, um, which can be felt, for instance, in this qi rushing upward to the chest kind of thing. Obviously, also it suffuses yang qi and blood into the organs and into the tissues, which helps to drive transformation. So that's the other aspect of it. So the real difference here is between using baizhu versus dazao. And the difference here is that baizhu is really used to suck out those stagnant fluids from the interstitia and help them drive them back into the spleen, stomach, and the small intestine so that they can then become physiological fluids again. Now, Dazao doesn't really have that ability. Like we say, Dazao kind of just locks blood in the circulation. It can funnel blood kind of downwards. Um, and so it's a different sort of, it's a very different mechanism at play there. So I'm going to skip right in the patterns here. I'm going to skip right to the stuff that looks a little bit different from Lingui Ganzao Tang, which is this stuff below here, like the difficulty urinating and a tendency toward edema. We're not seeing that as much in Lingui Ganzao Tang because we're not using Baizhu. And so this difficulty urinating, tendency toward edema shows how there's a much more prevalent kind of water metabolism breakdown in Lingui Zhugan Tang. And so this is also seen in the enlarged and swollen tongue with a white slippery coating. Obviously, also there can be teeth marks, right? There can be a scalloped tongue as well. Now, the other thing that also really highlights this is splashing sounds in the stomach. So if you can feel upon palpation, sorry, for splashing sounds in the stomach, that's another indication of this exuberant water, this replete room situation. Now, of course, also in Lingui Zhugantang, there could be palpitations, but notice it says palpitations below the heart or qi rising and surging to the chest. So the location is a little bit different because in Lingui Ganzao Tang, we talked about the palpitations being at or below the umbilicus. Okay. And so um, obviously it doesn't necessarily have to be that way. We looked at a case study where that wasn't the case. It was actually above the umbilicus, but classically, canonically, that would be where we're looking um, for the palpitations to be arising, either felt by the patient or palpated by the practitioner. There's a lot of information about different sort of symptom patterns for Lingui Zhugan. So we got sort of a classic look here from Huang Huang. Wang Ningyuan will also add some things here. He says orthostatic vertigo is very common in Lingui Zhugan. We talked about that sort of this issue of blood volume due to the lack of sort of physiological fluids due to the repleteness of a pathological fluid in Lingui Zhugan. So that would account for the orthostatic vertigo. Now he says this is compared to Tang, which can have like constant vertigo, which is kind of an interesting idea. Now, of course, again, going along with the theme of this room pathology, obviously we also have decreased urination here. Is another thing. Now and also the palpitations, of course, can be a sign of room. Now the other things here, a lot have seem to do with this um, counterflow, because of course the big line in Lingui Zhugan is qi rushing upwards to the chest. So that means you can get a sudden feeling of heat or sudden visual distortion. Okay, both of those have that sort of feel, that flavor of this sudden uprush of qi. And then, of course, maybe even head fullness or headache again is the kind of counterflow idea. Now, um, this is kind of an interesting one, which comes from kampo and Yamamoto Gen, who Lo Shaokun he really talks up in his book. He says that Yamamoto Gen is sort of like the top guy for kampo in Japan now. And so what does Yamamoto again say? Well, he said, like we've been stressing over and over, the patient has abundant evidence of stagnant fluid. And so he's going to have a difference in blood pressure between the upper and lower parts of the body, leading to neurogenic palpitation. So that's again this idea that's sort of like a POTS thing, basically, and sort of like an orthostatic vertigo idea where uh, blood is not being sort of sufficiently pumped to the upper body. And so you're getting this gradient of blood pressure across the body. Now, he also has this notion, which I don't know truthfully how helpful this is, but he's he harps on this point of the night owl profile. And so he says these kind of people constantly complain of various discomforts, lacking strength, fatigue, headaches, poor appetite, upward counterflow, stomach pain, dizziness, cold hands. They don't want to get out of bed in the morning and don't feel like sleeping at night. But during physical exams, they don't seem to have any sort of objective issues. There are no sort of organic changes in the body. It's mostly subjective. And so he says these people are just of a constitution that are prone to illness, which typically appears around 20 years old. And for women, symptoms often arise before the birth of their first child. At around 30 years, they tend to feel the most sluggish. But after 40, their complaints gradually decrease, and once they pass 60, they often become um, energetic and vigorous. And so he said the chief complaints of night owl type individuals are dizziness, palpitation, headache, and shoulder stiffness, all of which correspond to a Lingui Zhugan pattern. So, um, it's a very interesting sort of symptom profile there, and something you can definitely keep in mind for Lingui Zhugan. Um, Another couple things here, which are also important, is when water accumulates in the heart, there's hardness and throbbing below the heart, shortness of breath, and an aversion to water with no desire to drink. Um, so I think typically that's a little bit more, that can also be associated with Wulingsheim, but Lingui Zhugan as well, of course, because Lingui Zhugan we know has that shortness of breath idea, again, which you were saying, sort of impinging, this sort of swelling and sort of room accumulation impinging upon the lungs and heart, causing either the shortness of breath or the palpitations. Now, the other thing that I think is great to keep in mind is when there's retained fluid below the heart, the person will feel cold on the back in an area about the size of a hand. Okay. So obviously then that means that if we take this kind of idea called 诊疗一体, of treating where the symptom arises, that means that you can also warm the back to treat retained fluid below the heart. So that would mean doing some sort of moxibustion on the cold area of the back. And so these things are also thought to be associated with Lingui Zhugan Tang. Now, just to give us a kind of modern perspective, Huang Huang here likes to add this sort of spectrum of disease idea for Lingui Zhugan Tang. So we can think of Lingui Zhugan for a number of dizziness associated diseases like Meniere's, hypertensive vertigo, hypotension, etc. Diseases with palpitation, obviously, you can look at all the diseases listed there. Um, Disease with splashing sounds in the stomach as the main symptom. And so, of course, that again, that requires that we do some palpation on the stomach, of course. Disease with fullness of the chest and hypochondria. Um, Again, obviously, there are a lot of other formulas that treat this, but just to keep in mind, if it's a room associated fullness of the chest, then maybe you can look at these for asthma, bronchitis, etc. Now, another thing that's coming up again and again is that it can be used in diseases associated with the eyes, such as cataract, conjunctivitis, etc., etc. Again, probably having to do with the ability to promote this lymph draining, of course. And also from sort of a kampo or jingfang perspective, there's the fact that Lingui Zhugan is implicated in these counterflow, strong counterflow upwards kinds of diseases. Now, of course, there are all these other situations where you can use it as well. Probably the most common for people in clinic, I would say, is um, going to be that allergic rhinitis. So it's another thing to think of, or tinnitus as well. Now, from a Fukushin perspective, actually, this is going to look quite similar to Lingui Ganzhao Tang. The difference, there's a couple key differences. First, you can draw your attention to this area here. In this substernal area, you might get this glomus sort of situation. It might be even, it says hard glomus here, so it might be hard to the touch. Now, of course, it says that the palpitations are going to be more located above the umbilicus, as we said. There can be splashing sounds, and a slight spasticity to the uh, abdominis rectus, but I don't think that's really as important for this. Now, um, another one to look at that's not mentioned here is increased pulsation at Shuli in the between the fifth and sixth ribs. Again, a sort of palpitation sort of manifestation. Okay. Now, from a pulse perspective, remember we said for Lingui Ganzhao Tang, the pulse, replete pulse is going to be centered more at the left shi position, maybe a little bit in the left guan. Um, in Lingui Zhugan Tang, it's going to be more at the left guan. Now, Chen Jianguo also gives two situations for the Cun or overflow pulse. One is that there can be a very sunken pulse at the Cun position, similar to Guizhigan Cao Tang, where we're not getting enough sort of blood and yang qi flowing up to the upper part of the body. Now, that also chimes with what we've been discussing about, what Yamamoto again said maybe about this um, gradient of blood pressure where blood like where blood pressure is not well retained in the upper half of the body. And so you're getting this orthostatic vertigo and stuff like that. And then, of course, you can also have a um, overflow pulse, and that's indicative of the sort of counterflow situation that's also mentioned in Lingui Zhugantang, of course, in which we've harped on quite a bit. So both of those are potential um, things that can show up at the Cun or overflow position. Now, the other thing to keep in mind here is the right side pulse. Now, Chen Guo will say that in general, the left hand pulse is more prominent in Lingui Zhugantang. If that is the case, then, especially if at the left guan position, you should be using Changzhu probably as opposed to Baizhu. Changzhu is much more effusing um, than Baijiu. Baijiu has a little bit of a bitter, especially if it's raw, but even if it's also been treated, it has a little bit of a bitter, warm aspect to it and a down-bearing kind of quality. And so, that being said, if there is also a right one, slippery pulse, or even a slightly wiry pulse, then you can think about using Baizhu. You can also combine using Baizhu and Changzhu if there's left and right guan position. Now, remember, of course, we've talked about it before, but in a room pulse in the Chenjianguo system, typically you can feel the pulse from the most superficial position down to the deepest position. And it shouldn't really break as much at any position. It should be representative of this water. It's diffusive, diffusing nature, where it's going to fill up any cavity. And so it's not going to be, as opposed to um, like a chi stagnation where qi is blocked at some position. So we wouldn't expect to see the whole pulse filled out with the qi. It's probably in one position it's very strong because it's blocked and it can't move up or down. And so we feel it more strongly at one position. Whereas with a sort of a room pulse, you can it sort of feels about the same strength throughout the whole pulse. So that kind of encapsulates the pulse aspect of the the Lingui Zhugan pattern according to Chen Jianguo. And you can certainly see that's why it's important to feel all three positions, obviously. You can certainly see in some situations. I just had a patient yesterday who was um, a thyroid deficient patient, and they had that very sunken left Cun, but then a stronger pulse on the left Guan. That was clearly a room pulse, and they had this dizziness, orthostatic sort of vertigo. So there's a clear Lingui Zhugan Tang kind of pattern. We move on now here to case studies. This is first one is a kampo case study from Japan, from Kazuo Tatsuno. Um, and this is going to be a case where the patient had received dental treatment and the facial bone was perforated. And so then after that, he started experiencing this involuntary movement um, throughout his body, his hands and his head, which persisted for many years. And so he noted that during the attacks, he would also sweat profusely. Um, Normally, just every day, he also had complaints of tinnitus and a pulsing sensation throughout the body. Um, so, they ruled out Parkinson's disease, and they think it was a adenohypophysis. Not sure if I pronounced that correctly. Um, and so, uh, he the doctor came to think that this seemed to be a good fit for Lingui Zhugan Tang. He said, um, when you have this channels move and the body and tremble shakes, this is what he thought of. Of course, now Zhongwu Tang also has something similar, so you of course need to do some differential diagnosis here. Several formulas can treat this trembling and shaking. Fengyin Tang, for instance, um, a lot of Longomoli formulas as well. And so, um, but because the patient also had this profuse sweating during the attacks, he thought that that seemed to coincide well with Lingui Zhugan Tang. Also, the fact that though he didn't have any fullness below the heart or dizziness, he did have tinnitus, which was regarded as a kind of upward surging qi. And he also had these arterial pulsations throughout the body, which he thought seemed to correspond to this idea of movement of the channels. Of course, it can also be something like a palpitation, which would also fit in just fine um, with Lingui Zhugan Tang. And so he said, you know, you have this throbbing beneath the heart, abdominal palpitations, and urination are all common signs with Lingui Zhugan Tang. And so um, the pulse is often deep and tight, according to this doctor. And so for this reason, examining the pulse, he found that it was deep and weak at the twin position and tight at the trip position. Like we said, the pulse can often be weak at the twin position for reasons we mentioned above. Now, tight at the chi. Obviously, it could be at the chi or the guan position, um, indicating that sort of interior cold. Now, abdominal examination also found this pulsation beneath the ab. I think that just means I don't know if that means beneath the umbilicus or what. So there was no splashing sound. The urination was normal, but there was some sort of distinct intestinal movement around the navel, which he calls a kind of internal cold. And so, in summary, this suggests that internal cold has led to retained water. The retention of water results in abdominal pulsations, and when this surges upward to tinnitus. Um, so he says, because water is retained internally, the exterior consequently becomes dry and deficient in fluids. And so that's what leads to these involuntary limb movements. Like we said before, because there's sort of this replete pathological fluid, that means there's less physiological fluid to circulate nutrients to the muscles, which can cause this kind of spasms and various involuntary movements as well. And so this was a combination of doing symptom pattern style diagnosis combined with more of a abdominal style diagnosis. From the symptom pattern, um, of course, the primary symptom that he latched onto was the involuntary movements, which he then, correlated to this idea in Lingui Zhugantang of the body trembling and shaking. Now, on top of that, the fact that there was this tinnitus, he correlated with sort of a upward counterflow kind of idea, which is common among Jingfang practitioners, and this profuse sweating, which I'm not really sure if that's quite as um, linked to Lingui Zhugantang. Now, from the abdominal perspective, again, he found this um, pulsations, right? The abdominal pulsations, palpitations, you could say, um, which means that again, that can be indicative of this retention of water, this room situation, right? Um, and then, of course, the pulse itself, he also finds this twin position being weak, and then the lower positions being stronger, which again, we can also link to the Lingui Zhugan Tang. And so this is a nice example of that combination of using symptom pattern and an abdominal pattern, pulse pattern, all together to come to this diagnosis for this first case. So we can look at another case here from the kampo literature. This is from Katsutoshi Terasawa in the treatment of orthostatic hypotension with fatigue and weakness. So it's an 11-year-old boy who lost consciousness and collapsed while practicing for a school graduation. He was then diagnosed with orthostatic hypotension, but had normal EEG and CT scans. The patient had been experiencing fatigue and dull, heavy sensation in the head, as if covered by a veil, which is typically often a sign of rheum or dampness, right? He had taken some Western medicine without any improvement. Now, since early childhood, he had been physically weak, prone to catch colds, and he suffered motion sickness. And whenever traveling, he had to take anti-nausea medication. And then he was also experiencing dry throat and mouth and had reduced urine output. So you can see here his blood pressure was low, especially upon standing. It was at only 80/50. And after 5 minutes, it only rose to 88 over 52. He had this mild facial flushing, coldness of the lower limbs, moist skin. The pulse is wiry and thin, pale red tongue. Now, the abdominal tone is soft. And then we have additional abdominal findings here. He had this glomus, substernal glomus, hard glomus, I should say. He has palpitations, palpable above the umbilicus. He has splash sounds in the periumbilical area, and then he has very slight spasm or spasticity of the abdominis rectus. And so Katsutoshi diagnoses this as retention of water in the sea of qi, accompanied by qi deficiency. So there's symptoms of motion sickness, dizziness upon standing, thirst, scanty urine, and splashing sounds in the stomach all suggest this water retention. The tendency toward frequent infections and soft abdominal tone indicate the qi deficiency, and the flushed cheeks with coldness of the lower limbs reflect this counterflow of qi. Now, so he was given just Lingui Zhugan Tang. After the first week, or after the first day, the lower limbs became warmer, urinary frequency increased. After 1 week, thirst and heavy sensation disappeared. And after 2 months, he had an increase in his standing blood pressure. So it could get up to 94, where previously it was at, I think the highest was 82. Now, he was still feeling unwell, however, so they added Banxia Baizhu Tianma Tang to this. Um, and then after that, the situation, the patient's condition improved even more significantly. As we can see here, Banxia Baizhu Tianma Tang has that. It's basically treating again. It's a little bit like Tang. There's an Tang base to it, right? With the 陈皮 Fuling Banxia, then 甘草 Shangjiang Dazao. And so on top of that, you're just adding in this Baizhu Tianma and Manjingzi, um, which help, Tianma and Manjingzi probably have this kind of tropism to above. So sort of raising qi upwards. Um, and then Baizhu, of course, can also help with the room aspect. So what I really want people to focus in on here is when we feel, for instance, a room type pulse, typically, especially in the case of Lingui Zhugan Tang, on the left guan or on the right guan, to a lesser extent, then you can start to ask questions about room. So the question is, how do you diagnose room? So, for instance, motion sickness, driving is a good one. Obviously, dizziness upon standing is more specific to the Lingui Zhugan pathology, but thirst meaning the patient is unable to transform fluids effectively, so there's a lot of pathological fluid leading to thirst. Scanty urine, again, inability to transform fluids, the splashing sounds as well in the stomach. Now, what else can there be? Oftentimes, patients don't like to drink water, right? And then if they do drink water, maybe they even feel a little bit uncomfortable. I even have a patient who would get palpitations and some bloating in the stomach if they drank too much water. Okay, so obviously, now of course in Wuling-san, you have the classic line of as soon as they drink water, they throw up, right? So Wuling-san could be even more serious kind of room pathology because you also have you have Baizhu, Fuling, Zexi, and Zhuling, right? So it's four herbs that are all sort of treating water, as opposed to in Ling Tang, where you just have the Fuling and Baijiu, right? Um, and so that's just, once you have that suspicion, obviously another one is the leukorrhea for women, is another important one. Another one that sometimes I find is during the period, they might have swelling in the lower legs, and they might have some swelling below the eyes, especially as when they wake up in the morning. So all those are kind of signs of rheum to keep track of. Now, in this case, it's not just rheum; it's also very well zeroed in on a Lingui Zhugan pattern. Why? Well, obviously, the orthostatic hypotension is a sort of disease that's very much associated with Lingui Zhugan. Now, also, there's a lot of signs of counterflow. So, first of all, you have palpitations in the stomach. Then you also have this flushed face, which remember we talked about that before. Flushed face can be a sign, Lingui Zhugan, of this counterflow pathology. And then also the coldness of the lower limbs. So it's not that the patient has a real serious yang deficiency, but rather it's this. Um, I think the coldness of the lower limbs has to do with uh, the room in the middle, sort of blocking yang from being able um, to descend downwards. Because uh, if you look at the pulse in Lingui Zhugan Tang, it's centered in the middle in the guan position, and so because all of this upright chi is sort of drawn to the middle to try to ex sort of effuse this room pathogen outwards. As a result, that means there's less sort of chin blood moving down into the lower limbs. Okay, so that's the case in many pathologies dealing with the guan positions. And we'll get into that even more in the Shaoyang chapter, because if you look at a formula like Sinisan, for instance, of course, it has that lower and upper limb sort of coldness. And then you can also see that even in something like for instance, Da Chai Wu Tang as well. You can even see it in something like Bai Hu Tang, which is a Yangmin formula. But again, it's the fact that this upright chi is sort of centered. It's sort of clustered in the middle, right? And so it's unable to um, effuse outwards efficiently to the four limbs due to there being a pathogen in the middle. So I think that's all that we need to cover for this particular patient. He's got all of the hallmark signs as we see here, like we say, orthostatic hypotension, the low blood pressure, the counterflow, the signs of rheum. Okay, the palpitations in the abdomen plus the splash sounds in the abdomen as well. Now, Wuling Sun can also have vertigo and palpitations. Those are both also um, classical and canonical indications for Wuling Sun. But of course, Wuling Sun has a much stronger right Guan and Shi pulse, so it's pretty easy to distinguish between those just based upon pulse. So we can look at another case here from Liu Duzhou, and this is sort of a specialty of his, and we'll be looking at two cases here, two formulas um, in the area of coronary heart disease. So there's a 42-year-old patient, obese, hospitalized with coronary heart disease, myocardial infarction, with no improvement despite Western medical intervention. So he experienced pain in the heart and chest, palpitations, and shortness of breath, especially at night. During each attack, he felt a rush of qi surging upward to the throat, leading to a suffocating sensation, sometimes with dyspnea, profuse cold sweating, and a sense of impending death. The blood vessels along the side of the neck would pulse upward with the qi, accompanied by persistent palpitations and distending pain. And so his tongue was glossy and wet with dripping saliva, and his pulse was deep and wiry with occasional jia pulse, knotted pulse. So he diagnoses this as water qi attacking the heart with heart yang obstruction. Um, and he calls this water heart disease, which is a term he coined. And so then he prescribes Lingui Zhugan Tang, Guizhi being a little bit higher than normal at 12, Fuling at 30, Baizhu at 10, Zhigancao at 10. So after 3 doses, the upward surging qi subsided, the spirit calmed. However, the pulse remained knotted and there were signs of cold aversion and cold limbs, which were consistent with a yang deficient pattern. And so he then adds fuzi and rougui to restore the heart and kidney yang. After another 3 doses, the hands and feet become warm and cold aversion disappeared, though palpitations and shortness of breath still lingered. So finally, he then adds dangshan and weizi to tonify the qi of the heart, lung, and vessels. And then after 6 more doses, all symptoms completely resolved. So, of course, another thing that I didn't get to in the last case in terms of looking for, these room symptoms, of course, the tongue being glossy and wet with dripping saliva or having the teeth marks, right, are all good, also good signs for this room repletion. Now, let's see. So the other thing here, of course, again, we see this qi surging upward, right? So we're trying to choose between formulas, right? And we have, a certain kind of Lingui Zhugan Tang style pulse. And then on top of that, we see this qi surging upwards with palpitations, right? And also sweating, which again seems to come up a lot in the Lingui Zhugan Tang pattern. Then it's starting to look like a Lingui Zhugan Tang kind of pattern. He's got this strong pulsation in the neck. Again, this kind of upward qi kind of counterflow. And so there you go. Those are all really good signs again for Lingui Zhugan Tang. Now, what's interesting is then on top of that, he adds some other herbs. So it says there's signs of cold aversion and cold limbs. So now he's saying, well, maybe there's also a yang deficient aspect to this. So just using herbs that sort of help to, we can say, kind of attack the pathogen, either through, effusing this warmth into the area, or baizhu, which is sort of sucking it out of the interstitia into the centers of transformation in the middle, or fuling, which is again trying to fuse that. Maybe there's been kind of a yang deficiency to the point of a complete kind of breakdown of transformation. So just using those kinds of herbs is not enough. So then when you add on fuzi, rougui, now you're really driving transformation as opposed to just attacking the pathogen, moving it out of the body, so to speak. And so now you have that engine of warmth, of yang qi warmth, to drive the processes of transformation with foods. And so, of course, that's looking a little bit more like Zhenwu Tang. Of course, the only difference being that there's no Baisao or Shengjiang. And then once you add on top of that, you add sort of Sheng Mai Yin with the Dangshan Wu Wei. He takes out Mai Men Dong, of course, because the patient has this aversion to cold, so you don't want to use Maimendong, which is a much colder herb, then you're supporting both the the sort of xiantian or yuan qi sort of with fuzi and rou gui, and then you're also um, supporting this postnatal qi of the stomach and the spleen through dangshen. And so both are working to drive the processes of transformation, right? And so this also looks like a little bit like another formula, which is Da Xuan Wu Tang, which is sort of like a it's basically uh, a modification of Zheng Wu Tang, right? With again, it has the Fuling Baizhu um, and Gancao. It doesn't have Guizhi, but then it has Fuzi and it has Rensen. And then on top of that, they add Ganjiang, right? So that's sort of a another formula in this universe. Of course, for that, typically they're looking for also some more clear signs of this inhibited urine, be that, excessive urine at night while sleeping, or frequent urination during the day, or very substantial sort of swelling. Um, so this is already sort of this way of prescribing is actually already in the canon in the form of Da Shen Wu Tang. Of course, the difference being here they don't add Bai Sao. Now, another formula that Liu Duzhou will also use in this series of what he calls this he calls water heart disease, 水心病, um, is Ling Qian Tang. And this formula is used when there's a combination of um, a Ling Zhugan Tang kind of room with counterflow situation, but at the same time, you also have blood stagnation. And that blood stagnation, he says, will show up as stabbing chest pain radiating to the back. Um, and so this is another formula that he created in this series to deal with that kind of pathology. And so he says, in recent years, these formulas for treating coronary heart disease emphasize invigorating blood and resolving stasis, 川芎, 木香, yujin. These relieve pain, but they're also a bit drying and qi depleting. And so, Zhang Zhongjing has, for instance, Gualo Xiebai Banxia Tang, which, on top of having the Xiebai and Banxia, which are certainly drying and pungent dispersing, he has that Gualo in. Um, and so you'll notice with Lingui Qianhong Tang, it's not as drying and dispersing. It's more, Honghua, while it relieves, blood stagnation, it doesn't have that drying quality to it, I think is kind of what he's trying to get at there. And so we can look at a case that he uses this Lingui Qianhong Tang. And so for this case, we don't get a lot of details, but he just says, the patient has a water qi surging upward accompanied by stabbing pain in the right chest. So we can imagine that that might include, for instance, palpitations, and then maybe also he's looking at the tongue and seeing, again, this sort of watery kind of tongue, maybe with the scalloped tongue, maybe a bit swollen, right? Maybe there's splashing sounds in the stomach. He says that he is promoting urination, so maybe there's inhibited urination of some kind. But then on top of that, there's stabbing pain in the right chest. So when there's stabbing pain, that often indicates a blood stagnation, right? So like Liu Duzhou says here, it seemed almost like a Lingui Zhugan Tang kind of case, but the Lingui Zhugan Tang doesn't have enough to invigorate the blood and open the collaterals.
And so he modifies it with this Qincao and Honghua, using 10 grams each of Qincao Honghua, um, and then taking out Baijiu and Gantao, which he says are tonifying and restraining. So they might actually kind of work against the this collateral in vessel opening and blood stagnation resolving action of the Qiancao and Honghua. And so that's how he came to use this formula. And you'll notice again, he uses that 30 grams of Fuling with 12 grams of Guizi, and then with the 10 grams each of the Qiancao and Honghua. Um, Now, interestingly, he also says if you have this kind of pattern, then on top of that, they also have hypertension. You can add Niuxi. Of course, Niuxi is great because, first of all, it has just sort of an antihypertensive quality to it. It has that action, so to speak. And then on top of that, it's blood moving and diuretic. So it really works well with this particular pattern where you have both this room and you have the room and the blood stagnation. So of course, um, that's a really nice addition that we can add on to this formula to strengthen it, especially as he says in the case of hypertension, which of course is a little bit different from our typical idea of Lingui Zhugan Tang, which often has more of um, that hypotension to it. Of course, because you have Gantao in there, which helps to preserve uh, the blood volume, right? And so it helps to increase blood pressure to a degree. Now, once we take that out, um, and and we add in Yoshi, now we're looking at more of something that can attack that hypertension aspect with more of a diuretic quality. Of course, also adding in um, these these herbs that help to open up the collaterals, Qincao and Honghua. Of course, Guizhi too, in its own way, helps to open up the collaterals. And so by unblocking the collaterals, that means that the body doesn't have to add pressure to the same degree, and it can also be a way of lowering blood pressure. Okay. Similar to Zhongwutang, it's sort of a little bit like Zhongwutang here, um, except that it's using Qincao Honghua as opposed to like a Baishao kind of situation.